Here's a medical thing they don't tell you. Cancer technology is advancing faster than any other field of medicine, and these are my predictions for how things will change in the next 5 years. I'm just starting my career as an oncologist now, and the conversations I have with my higher-ups who have been practicing for 30 years usually center around the fact that now we have access to personalized cancer treatment. In the 1980s, if two people had lung cancer, chances are they were being treated with the same exact chemotherapy regimen. Nowadays in 2024, not only do we still have access to chemotherapy that sometimes works and sometimes doesn't, but we also have access to immunotherapy as well as targeted therapy. And again, sometimes they work, sometimes they don't. But generally speaking, they are better tolerated for patients, and generally speaking, they do have better results. Again, this is generally speaking. There are stories that go the other way. However, I think the exciting part in the next 5 years is that the personalized medicine aspect of things will only grow stronger. The personalized aspect just comes down to your genetics, and we keep unlocking more and more genes as we figure out what their exact mechanism is for causing cancer. Once you know what mutation happens to what gene, you can try to make a therapeutic to attack that mutation to hopefully stop whatever problem that gene was causing, which is usually cancer. All right, now we got some waves coming. These aren't necessarily drugs that are not available yet. Some of these drugs are already available, and I already have patients on these, and these patients that could have otherwise passed within a few months are now living years. Again, this is just the beginning. We just started doing all this in the last 5-10 years. God only knows what the next 20 years have in store for us, and you should be very excited about that.